Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212 Choices. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212 Choices.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212 Choices for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hi, we're back. I want to talk about a woman, 59 years old, black woman with diabetes. Her mother died at age 45 of breast cancer, and now she comes in with breast cancer. She had a needle biopsy, and then she had a lumpectomy, which means the lump of cancer was removed along with a lymph node. The lymph node was negative. So she had a small cancer. There's a staging system to tell you the extent of the cancer. T1, T2, T3, T4. She is T1, so she has the smallest stage, the lowest stage, and the sentinel node was negative. So actually, she's very favorable risk. She was seen by a chemo doctor who recommended extensive chemo and then the radiation and came to us for a second opinion. Well, in fact, she's got a great prognosis. 90% chance she's going to be cancer-free. She's going to live a normal life. And we certainly believe that by providing the radiation after lumpectomy, and there's data to show that women who have their breast intact, remove the lump of cancer, and have radiation, actually live as long, and many studies show longer than the women who have mastectomy. So certainly there's no need for mastectomy, and there's very little need, probably none, for chemotherapy. So she was happy that she came for a second opinion. We sat down, we reviewed all her records, and told her this information. So she's proceeding, and not surprisingly, she's proceeding because most likely she's going to have a great cosmetic result. She's going to have a great medical result, and most likely will live a normal life, and she won't even have a reminder of that mastectomy or radical or modified radical surgery. So we applaud her and wish her all the best. Also this week we had a barber from upstate came in. He and his wife, Italian speaking immigrants, they still speak Italiano, and we speak Italiano when he comes, he and his wife. He was treated with our treatment for prostate cancer in the stereotactic frame and brachytherapy 10 years ago. His PSA is in complete remission now, more than a decade. His PSA is 0.04, so it's negligible. He's fully intact. His urine is intact. He's sexually active, and I was always impressed that he maintains a regular sexual activity with his wife of 45 years. He's planning soon to move to Atlanta to be with his children, but he's fully intact after treatment, sexual function, urinary function, and no cancer. So again, the good news department, and it's fantastic. We have another man who came in, entered the good news department. He had a PSA 9 prostate cancer, Gleason 6, just treated last year, and already first follow-up. And his PSA is down to 0.93. So he's had a 90% reduction in the PSA. So statistically, he's very favorable. And our statistics for someone in his category is about 95% chance of being cancer-free. So not only is prognosis excellent, but he's actually manifesting that with this tremendous fall in his PSA. And he's doing well. He's happy, content, and fully intact. There's been a lot of controversy about when mammography should be done and whether mammography should be done. And there was an article this week by Daniel Kopens, professor from Harvard Medical School. And he wrote that there's a disconcerting effort to reduce women's access to mammography screening, making it seem useless or even harmful. And he reports the data goes back to 2009 over Obamacare, when the United States Preventative Services Task Force tried to reduce mammography from women starting in the 40s to at age 50. No one on the task force had any experience treating people with breast cancer, not surprising, but they were going to tell physicians and the women of America how they should be screened and treated. Shocking, really. So what's the data? Well, there was a new recommendation suggesting that, again, women shouldn't get mammography, and the public outcry was tremendous. Many saw the recommendations to limit women's access as an attempt to scale back healthcare spending at the expense of women's health. Now, Obama administration eventually said he didn't support the task force, but wow, it took a long time, and wonder who's thinking, are you just trying to save pennies, trying to save an inconvenience, or you're going to allow thousands of women possibly to die unnecessarily. Now, Coppens wrote, and I quote, all the scientific study to date, including large randomized controlled studies, show that screening for breast cancer saves lives. Screening began in the United States in the 1980s. In 1990, the mortality rate from breast cancer, that's how many people die, the rate of death from breast cancer, which had been unchanged for 50 years, began a steady decline. Today, there's 30% fewer women who die from breast cancer than would have died if we still had the pre-1990 death rate. That's about 20,000 lives saved annually. Wow. So, yes, treatment is better, of course. Radiation is better. Chemo may be better. But everyone works hand in hand, and we're all working on the shoulders of giants. The idea to limit access for women for mammography is probably short-sighted. Women should know the facts, and to mandate that women can't have mammography seems a little high-handed. And remember, we were promised that patients were going to allow to be able to keep their physicians, and the physicians were going to be able to make recommendations, not the government and not insurance companies. So it's a little bit heavy-handed, and all of you should understand that you have rights, and you should speak to your physicians. As I always say, sit down with your physician, close the door, spend some time together, and talk about, is mammography right for you? Why is it right for you? Are you doing self-examination? Are you getting ultrasound? Are you getting MRI? What are you getting, especially for those who are at higher risk with family history? But remember that most women with breast cancer don't have risks. They don't have risks of family. So every woman really needs to be screened, and every woman needs to be concerned. And in the breast cancer department, the Washington Post this week reported that specialists in a Washington, D.C. hospital are trying to find out why African-American women are showing up for treatment with more advanced breast cancer, almost double the rate in the nation. So at this hospital, the MedStar Washington Hospital, 1,700 women who went to the hospital for cancer treatment between 2006 and 2011, 311 or 18% had stage 3 or stage 4 cancer. Nationally, only about 10% of breast cancer patients are stage 3 or stage 4. Now, we've talked about this before, and some of the issues are delay in workup. Women who have breast cancer need to go to their physician and not delay. Women need to get their regular mammograms and self-examination. We, of course, never blame the patient, but in this day and age, if you haven't had a mammogram, you most probably should have a mammogram. If you haven't examined your own breasts, you should be doing that. If, God forbid, you have a cancer, please go pell-mell to the doctor. And we promise patients we'll see any of you within one business day, because we believe that we'd rather work harder than have patients suffering in silence at home with the cancer growing. So there's another study talking about Black Americans having higher rates of death, breast cancer, and we've reported earlier this year Black men with prostate cancer having higher death rates, mainly because of delays. So please don't delay. Call us, and you're welcome to call us anytime at 212-CHOICES, which is our office number. Make an appointment, come in, and let's go over all the details. That's 212-CHOICES, which is 212-246-4237. 212-246-4237. And I want to talk about a gentleman, 60-year-old, also black man with 4 children. He was hospitalized with back pain, night sweats. Now, often people have back pain. Everyone says, I have sciatica or I strained my back, and they never get a workup. And sometimes even insurance companies don't let you get a workup. I've had patients come to me, new patients without a history of cancer, coming with new back pain, and I call to get approval for MRIs or CAT scans. And very commonly, the insurance companies will say, well, send them for physical therapy. Well, physical therapy without a diagnosis is not probably the best approach. So this man went and had a CAT scan because the pain was so severe. He was placed on narcotics for his severity. He, in fact, had extensive lymph node involvement in his retroperitoneal area, which is the lymph node-bearing part of the abdominal and pelvic area behind the stomach by the spine. And most probably, it's these lymph nodes that are causing the pain. He came to us this week. Within an hour, we arranged complete staging for this man and a little needle to go in, painless needle to biopsy this, which is most likely going to show a cancer, very likely a lymphoma, which is highly treatable and highly successfully treated. So if you have a new back pain or a new something or other, you may not want to just guess at the diagnosis. Guessing may get you into trouble. And we don't like to be in trouble. We like to know for a fact. You have something, find out, treat it, make it better. Or if you don't have anything, let's be reassured you don't have anything and you can go on with your life. And this week we also saw a man with ameloblastoma. So if any of you have heard what an ameloblastoma is, call us at 1-800-321-0710. I would like to have someone's experience about ameloblastoma. Remember earlier this morning on our show, we talked about us having such an experience that we have patients with cancers and tumors most anywhere in the body. Well, this is a tumor. It's a benign tumor, but it can cause great destruction. And it's actually from the elements of the teeth. So if you don't think that a teeth can cause tumor, here you go. Ameloblastoma. He had radical surgery in New Jersey about 3 years ago. The doctors cut out the tumor. They cut out a large part of his mandible. They took part of his rib and his bone and tried to reconstruct his mandible. And whoops, it all grew back. So right now, if you saw this man, it looks like his tongue is sticking out of his mouth, but it's not his tongue. It's this big mass of ameloblastoma. It's a tumor that he's had cut out, and it grew right back, probably because when the surgeons cut, they left crumbs, and the crumbs grew back, because obviously it wouldn't have grown back if there weren't crumbs there. So he wishes us to treat him with radiosurgery, and we have a very extensive experience treating benign and malignant tumors. So we treat many benign tumors like pituitary tumors and acoustic neuromas and meningiomas. Many. We actually have the world's largest experience treating a benign tumor called acoustic neuroma with fractionated stereotactic non-invasive radiosurgery, 5 treatments. We have the largest experience in the world. So this man's starting with treatment, and we'll report back. We'll probably write him up for scientific information as well, because it's a pretty rare tumor, and he's come for innovative treatment that's non-invasive. He just can't stand the thought of having surgery. We're going to stop just for a moment. We have an announcement, and we'll be back. If you have questions, please call us at 1-800-321-0710, 1-800-321-0710.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one